Hi, I'm Senator Adam Hollier, and this is the We Can Do Better podcast, where we interview people who are doing amazing and interesting things in the second Senate district and across Michigan. Today, I have some really exciting guests here from the Matrix Human Services. Brad, do you want to introduce yourself, and then Kerrie, you can follow?
Sure. I'm Brad Coulter. I'm President and CEO of Matrix Human Services.
And my name is Kerrie Mitchell, and I'm the Vice President of Marketing and Development for Matrix Human Services.
So I've known Matrix kind of through the Matrix Center for like what seems like forever. When I was in grad school, we went over, did programming, and you're just kind of a staple in the neighborhood over there on the Northeast side. Brad, do you want to tell us a little bit about how you got started and some of the things that are going on right now?
Sure. So Matrix has been serving Detroit since 1906, believe it or not. We were originally the League of Catholic Women and then morphed into Matrix Human Services in the 90s. We're about $50 million a year in revenue with 500 employees working every day to help people in the city. Our mission is to give people hope. We give people hope. We coordinate resources to help people realize a better future. And that's the philosophy in all of our programming that we do. And even with COVID, we didn't stop because our clients' needs didn't stop. So we shifted to remote programming as best as possible. We even went out and bought about 800 tablets and hooked people up with 4G wireless plans so they'd have connectivity, and really tried our best to stay in touch with our client base and keep them moving forward. It's funny you bring up the Matrix Center. That's one of our pet projects. It's really, I'm a firm believer in these community centers in terms of what they can do for placemaking, and especially having all the social services right there in one spot for a neighborhood. So at the Matrix Center, and Kerrie was key in this, we really ramped up our food distribution for that area over and above what we'd normally been doing in the past.
Yeah, because I think for me, I didn't know that there was an entity outside of the physical center for probably a number of years. I was like, oh, they do more things. And it was really in a conversation about, who was it? I think Southwest Solutions, as we were talking about them, and they were talking about the community mental health agencies across the city. And I was like, oh, that's what they really do? I never knew. And so, Kerrie, you probably have an interesting job of kind of telling the story of an organization that people know based on the services that they receive, not necessarily all the services that you provide. So what is that like?
Yeah, so we, like Brad mentioned, we do so much, and the Matrix Center is so important to us. It's in a neighborhood that I'm from, which is the 48205 area code, and so I'm most happy and most proud of the things that we've been able to do, particularly in that community through the Matrix Center. Our largest program for Matrix Human Services is Head Start. We're the largest Head Start provider in the city of Detroit, and we have about 16 centers throughout the city, and then 22 other private childcare partners that we partner with throughout the city. So when you think about early childhood, we pretty much kind of are considered the experts in that field, with understanding, what it takes to educate a child that is from birth to 5, and also what the family needs to kind of bring them up to self-sufficiency as well. And then we also have teen and youth programming. And in that sector, we kind of create a program for them that gives them the accessibility to make sure they have everything they need to graduate high school. So whether we're providing tutoring, whether we're providing case management support, extracurricular activities, our goal is to get them to stay out of the judicial system and going into some type of higher education or into STEM activities and things of that nature to make sure they're prepared to be successful for the real world. And then we have a wealth of adult programming that focuses on ensuring that the adults, regardless of their background, that they are equipped to live a better or sustainable life. So those programs include an online high school diploma program, which is different from a GED because, sometimes a GED comes with a stigma. This is a completely an online program that gives them a diploma once they finish. We also do a lot of financial education. The great component about the financial education is that while we're doing we get their credit scores for them, we get make sure they learn how to budget, but we also have a proponent in there that allows them to become first-time home buyers in the city of Detroit as well. And then we have a really robust robust workforce development program that works to not only get them prepared for a job, but we create partnerships with other businesses around the city of Detroit, where we create that pipeline for them to have a successful job, and actually provide their case manager some more support, that even if they do get this job, we help them maintain the job, just in case some, life crises may happen. We kind of are there to kind of intersect that. And then we have a senior program. The senior program is making sure our mature population stays healthy and active, during their later years in life. And then we have a large community health division that focuses on the prevention of HIV, the virus, and also living a healthy life if they do become HIV positive. So it's such a wealth of things that Matrix does, and I'm just grateful to be a part of the program to explain it, what we do, understand how people can get involved, because we always need extra support, and people are just willing to support us because we do such great work in the community, and our clients really do see, they come to us, this way, and then we provide that hope and that structure, and then they become self-sufficient on their own. And it's an awesome experience just to be here to see it, help it, and be a part of it.
All right. So you said let's start with Head Start. So
Yeah.
Brad, you want to explain what Head Start is? I know it used to be Head Start. Now it's Great Start Readiness, and people are like, what is the difference? How does, the income limits work? What does Head Start look like in a pandemic from the experts?
Yeah, so Head Start's federally funded preschool. It's been around since 1965. It has support on both sides of the aisle. It's a very, very strong and proven program for preschool kids. It's curriculum-based preschool. So we have lesson plans, we have curriculum, and it's really taking children from age 0 to 5 and giving them life skills, how to get along with other kids, how to share, conflict resolution. They eat family style and pass food and learn that. Plus we focus on the basics of numbers and letters and everything else, but with the whole goal of getting that child ready to transition into kindergarten and being prepared for kindergarten. And there's a huge difference between a child who's gone through a curriculum-based preschool when they get to kindergarten and maybe a child that's just done daycare. So we work with children 0 to 5 in Head Start. Great Start Readiness is the state program, and that's specifically for 4-year-olds. Okay. So it's similar in that it's curriculum based, but the component it doesn't have that Head Start brings is that in Head Start, every family is assigned a family advocate or a counselor to work with that family on their needs, such as housing, education, transportation, or what other barriers that they may have. And that's where really we see the success in Head Start, because the philosophy is you can have everything going great and doing everything you can for that child in the classroom, but if they're coming home to an unstable home environment or a stressful home environment, those gains don't stick. So we want to have a nurturing spot for the child in the classroom, plus do the best we can to help the family out so that they have a stable situation at home as well.
And so who's eligible for Head Start? What does that process look like? How does somebody say, hey, I have a little kid, maybe I should be thinking about Head Start or Great Start Readiness? What should parents be thinking and doing?
So for Head Start, the income eligibility guidelines are the family has to be at the poverty line or below to be eligible. We are able to take some families that are 110% of the poverty line and above, but that's a little limited. So it's really families at the poverty line or below, which in the city of Detroit is a substantial number of people.
And are all your spots filled up? Do you fill up? Do you have open spots? What does that look like?
Typically we're full. Oh, sorry, Kerrie.
Oh, sorry. That's okay.
Go ahead.
We are accepting enrollment actually right now. So if people were to go to our website, matrixhumanservices.org, they would have the option of being into the program either virtually or in person. Our centers have been open at least for the last week or so.
Okay. So if you're a parent and you don't know you don't have a good space for your kids, and you are at or below the poverty line, that you potentially have a space for them.
That is true. And they would just, Right, and they will give us a call. Another thing that I'd just like to mention too is that even though that it is federally funded, it's only federally funded at an 80%. And so it's still our job within Matrix Human Services to provide that other 20%, not only for the Head Start program, but also for the other things that we do throughout the organization as well, that the Head Start families have the accessibility of being a part of. So if it's just as simple as giving us a call, we'll do the income verification. We'll go through all those points with that person, and then we'll set them up. And the great thing is that once you kind of talk to someone at Matrix, we ask a lot of additional qualifying questions to see even if Head Start isn't a great fit for you. We have partnerships or just being around any other nonprofit that does things well. It's our goal to try to get you hooked up with something that will help benefit your family.
And so let's say you're a parent, but you are above that 110%. Could they still just pay for class, or is that an option? How does that work? Do you have spaces for folks who may be in that like 150 or 200 or even nowhere near the income limit? Can they supplement that 20% by paying for enrollment? Is that a thing?
Right now, not with us. It's not, we haven't gone into private pay. Great Start Readiness, I believe, goes up to 250% of the poverty line. So children, 4-year-olds would be eligible for the GSRP program that's run by the state. We do have a couple of GSRP classrooms, or we can refer those children to some of our private childcare partners.
And I was going to say that, yeah. So we have 22 childcare partners throughout the city of Detroit. So even if someone was to give us a call, it doesn't mean that the answer is just going to be an outright no from us. Even if they, can't be in our program, we still have those childcare partnerships that actually are still opening for enrollment as well. And so theirs work a little bit different as far as structure and funding, where it is a possibility. So the crux is really just for them to give us a call, and then we try to work out something that is going to kind of help them in whatever need they may have.
Right. So we've kind of covered birth to school. You said you have another big program for teenagers or high school students. How does that program work? What do you do there?
Sure, it's a little background noise, so if you may hear that, I'm sorry, it's coming through. What we do with our teen and youth program is from 10 to 17 years old. And we primarily, before COVID, we were in schools and after school programming to kind of help them with case management support, making sure that they have conflict resolution skills, making sure they are, learning at the natural grade level. So we did a lot of tutoring. A lot of what we're doing inside of the schools, we've been able to do virtually, just by providing those tablets. We got a lot of donors that was able to provide those tablets to us. And so we were able to actually kind of increase the capacity of the youth that we were serving in that arena. And we actually are still looking for youth too. So if someone wants to get involved in our youth programming, they can just go to our website again, click on the youth tab, and you'll see all of the things that we offer. What we've been intentional to do in COVID is to make sure that the kids kind of come out just as, healthy, in their mind and their mental health as, we are. COVID was challenging for all of us. And so what we did towards the end of the year was create a partnership with the Black United Fund. They had a lot of apprenticeships programs like with aviation, nursing, and things of that nature. We partner with them to ensure that our children as well can have the accessibility of learning all of these different roles and jobs to see if that's something that they would like to go into. We also are a big one of the largest partners in the Grow Detroit Young Talent initiative that's through the city of Detroit. And that's when we get and employ over 150 youth and teens into that program as well, that we kind of create those partnerships with different businesses around. So this time we're going to be a little bit more intentional. You're going to have those apprenticeship programs, but then we're going to find places that we can partner with so they can get that on the job experience through that Grow Detroit Young Talent while they're still able to get paid, and see if this is a career that they want to go into. And so we've had a tremendous amount of success with finding children that want to be a part of the program. The great thing is that we supply all of the children with the tablets, so they have the accessibility to be in the program. And then we also created a golf program as well. And so we're creating all of these different things to make sure that the kids still find a way to be active in spite of still having to be stuck in the house.
Right, that sounds like a lot of logistics to manage. How have you been handling kind of the whole thing of running an in-person at home, distance, recruitment, and service providing space throughout the last year. What does that look like over at Matrix?
I'm really lucky to have a very strong team throughout all of our programs. So we surprisingly moved from in-person to remote relatively quickly and easily. And it wasn't anything that I directed. Everybody just took their own personal responsibility to, what do I need to do to shift remote and still keep, doing what I need to do. So it went pretty smoothly. I think what we're finding is you have to be more intentional about meetings, especially with Zoom. You don't have all those casual conversations that you normally would have around the office or when you're out visiting the facilities. So if anything, we're a little more intentional about that. We're really working now to try and figure out how to come back safely. Especially in Head Start, we've made a lot of investment in UV cleaning machines and extra custodians for safety and cleaning. How can we come back and keep kids safe and keep staff safe in the centers? It's been hit and miss so far, but we're trying to make it work, because I think we're all very worried what's happened with both our preschool kids and our teens with being out for a year. Just the lack of stimulation, the lack of outside activity. I think it's something we're going to be working through for a while.
And Brad, you bring up a good point. I mean, usually when people hear that, we have 500 employees and we're kind of spread out without, by like 35 or 40 locations, we always have to come back and say it's 500 employees, but primarily most of them work with our clients and speak with our clients on a day-to-day basis. And that's why we're able to serve 20,000 people as closely as we are able to serve them. Like, we have personal relationships with our clients where we know them. So when the pandemic happened, we know that they were a phone call away. And since we were already kind of in their lives anyway, and they trust us, they were more open to telling us the needs that they had. And we were able to make sure that we converted our programs, that we were still able to meet their needs in spite of us not being physically present to be able to meet with them. And even though we are a large organization, we operate a lot like a family when it comes to ensuring that our clients have the support they need and that our staff have the support that they need from us as well. Because, we were all in a pandemic. We all had to go through something, and we all had to do check-ins with ourselves, that while we're trying to ensure that our clients are taken care of, it's like, okay, well, have you checked on yourself? Have you done any of those things? Mm-hmm. And so that's be successful with converting it over, because we already had a touch point of what our clients were going through in every moment.
And fortunately, we'd made the upfront investments in technology. So we had already been moving our servers to the cloud. We'd already been investing in Zoom and Teams capabilities and everything else. So a lot of those things were in place. It certainly forced us to shift over to remote programming much faster than we planned on. But in terms of going to electronic records and everything else, I think we're coming out a much stronger organization when we get done with this.
And so we've kind of talked about little kids, teenagers, but that wraparound service, I think, is always critical, right? Like, everyone wants to take care of babies and little kids, and then at-risk teenagers is kind of how we describe it. But very few people and organizations are able to do the first two and also provide services to the family where we know the majority of the need is. Can you talk a little bit about how that part of the programming works and what that transition is? So, I call like, hey, I want to get something done with my 3-year-old. And you're like, hey, I understand you also have a teenager. We have programs for them. And, what are you looking at with this? How does that system work to making someone a part, to serving the entire family, not just that little kid or that teenager?
Yeah. So, I'll tell you what, Adam, this is pretty much what brought me to Matrix Human Services. I worked in 2 other nonprofits before my stop here. And what I liked is that, we service children. And then when I got to Matrix and I realized we served a whole gamut, you know what I mean, from birth all the way to seniors, that's really what got me, because you're right, as a parent or as a family, I'll be honest, a lot of times when trying to even just funnel donations to the stuff that we need for the adults, sometimes, I may be hit with like, well, why doesn't this person have a high school diploma and they're 25? Or why doesn't this person know how to budget? And you don't know what you never was exposed to.
Yep.
And so a lot of what we have to do is get them to understand, like, some of these things that, regardless of your age, we can't judge you that you don't know it. We're just here to supply the need for you. If you say that you want to do X, Y, and Z, we're going to get that for you. We're going to walk you through that process, and we're going to congratulate you with every goal that you were able to meet. And that's really how you're going to change poverty in the city of Detroit. We can, like Brad mentioned, we can have all of the most successful gains inside of the classroom, but if the mindset and the structure isn't changing at home, then those gains sometimes can be lost. And so we wanted to put an extra emphasis on not only just working with the families in Head Start, but we're working with families throughout the city of Detroit with any kind of need that they may have. And it may start off small. They may come to us and just saying, I want a job. And this, well, let's get you a job. Now, what's going to take for you to keep the job? We supply all of those things. If you don't have a car at the moment, if we have bus tickets, we're going to give that to you. If you don't know how to budget or you can't feed your, family, we have a food pantry program that, we do on a weekly basis. Perhaps you can get, that food for your family, and then we can help budget and do something else with those extra funds that you might have. So we really are boots to the ground, working, individualizing a plan for each family. It's not a one size fits all. And so that's why I always encourage people to just give us a call. And we even have a whole resource center, whereas let's say if Matrix doesn't do it, even though we do a lot, we understand that it's a lot of stuff, that we just don't do, but it doesn't mean that we couldn't tell them about it. We still keep them in our care. We refer them over to another nonprofit or another source that does that work really well, and we don't want to go into what they do really well, because I believe if you are expert, be an expert in your field, but that doesn't mean that they don't come back to us. We keep that connection open, and we help them with the things that we're able to do. And so it really is that holistic approach. And when you see it time and time again, when you see that success, when someone comes up, it was a 34-year-old woman who had been working underneath the table for 34 years. And you can imagine she's not making a livable wage. She's trying the best she can, but she couldn't get it because she just simply didn't have a high school diploma. And after she got her high school diploma through our program, she now, decided, I think I can be an entrepreneur. And that was something that she had never thought of. Never she would ever be qualified to be something like that. She just did not have that type of goal setting in her mind to think that she could ever attain something like that. But once you really put it in her mind that she can have a high school diploma, it just opened up her mind and her way of thinking that I can achieve these things if I just put my mind to it. And she became an entrepreneur. And then she brought back, 2 or 3 of her family members who also didn't have a diploma, who wanted to be different in their lives as well. So it became a trickle effect. When you help one, you help all. I always tell people, within the client base, we have a strong name and a strong reputation because we truly care about making sure that our clients get everything that they need to be successful.
And I think, just to add on quickly on that, you can't underestimate the importance of coaching. I mean, it doesn't work just to throw the resources out there and tell people to go find them, or expect that people are going to really believe that they can make a better life for themselves. You really need coaches that can help kind of provide a path and help them work through the bumps in the road that are going to occur, even once you get somebody employed or get them into a house. So we find just having hands-on coaching for people makes a huge difference.
Awesome. Well, it sounds like you all are doing really incredible work and interesting things. What are we missing? What else should people know Matrix does that we haven't covered?
Well, we have a senior program a section of the senior program that we just launched. It's called a Healthy Food Initiative. And pretty much what we supply is a food prescription. So we partner with Eastern Market and Forgotten Harvest, and we supply them. We would either bring the food to them or they can come and get the food from us on a bi-weekly basis. And we also partner with the Huda Clinic to provide free health screenings for the seniors in the program. So if the senior is over the age of 55 years old, and they have, if they're pre-diabetic or have heart, disease or anything of that nature, they can sign up for this food prescription program. And the whole goal is to just make sure that we are decreasing our morbidity rate within our seniors in the city of Detroit, to provide them access to healthy foods and access to health screening so that they know exactly what's going on with them. And we pretty much got that program through a study that came out and said that, the seniors in the city of Detroit were experiencing dying at a faster rate than really it needs to. And it was because they didn't have a direct access to those healthy foods. So if someone wants to get in that program, again, they just go to our website, click the senior link, and they can get signed up. And we have, at least we have about, I want to say 100 more slots available. It's a new program that we literally just launched within the last month or so.
Well, that's really exciting. So you're doing all these wonderful things for other people. What are you doing to stay active? With COVID-19, I think we've talked a great deal about the importance of maintaining our own physical health and being active and doing those kind of things. What are you doing right now? What's your go-to?
Brad, you can answer that first.
Yeah, we have a rescue dog. She's a 100-pound German Shepherd. And with COVID and us, my wife and I being at home all the time for a long period, she kind of got a little protective. So we've had to take her to a dog trainer, and we just are doing a lot of work with her to build up her confidence and kind of get her back in sorts. So it's kind of fun too. It really allows us to spend some time outside with her.
You're going on really long walks with a big dog pulling you down the street. Cool.
Yes. Yep.
For me, I just been really staying in contact with family. I feel like they are my source of strength. They make me laugh. They make me think. They make me cry sometimes. But us just really honing in and just loving each other through this, during this time, it really just put an emphasis on why we are, here for one another. And I'm just most grateful that all of us are here. My sister, who's a little older than me, she actually had COVID. And so we are just extremely grateful that she is still here. She's healthy, and she is strong. And so really, I use this time to put emphasis back on family.
And tell everybody how many people you're cooking for this weekend.
Oh gosh. Okay, so I am hosting Easter dinner since my parents are vaccinated, I'm vaccinated, and my sisters are vaccinated. So it's going to be about 15 people over for me to cook for. So that's exciting and overwhelming.
Yeah, I'm glad to hear you're vaccinated. It's been such an important part of us getting out of the train. And so I'm glad that you are sharing and that you're able to take advantage of the world kind of getting back to normal. It's such an important piece for us to continue to encourage people to get the safe and effective vaccines and to tell their friends and to do it, because that is really the way that we're going to make sure people stay safe.
Yeah.
I'll tell you, we all went through the TCF Center through the city, and the city of Detroit is amazingly well organized. If anyone's gone through TCF, it's such a smooth, professional process. You couldn't ask for anything better.
Yeah, that's where I got both shots. First, not an issue. That second one, I was tired for like 3 or 4 days. I mean, I was pretty down, but
it's all part of it's what has to be done. So
yeah. It was the best feeling ever. You talk to people and everyone's like, well, and some people, when they had more severe symptoms, they're like, oh, it was really, my arm was sore and I was like, but that means it was working. So I'm really glad that I got, it's the first time anybody's been like, I'm really glad that I was knocked out after this thing. And they're like, that means I got those antibodies. My body was like, this stuff bad, gonna kill it.
Exactly.
So but it was such a fun time getting a chance to get to know you and to talk a little bit about the incredibly important work that you all are doing. Kerrie, if you just want to give us again how people can get in contact and just that last pitch of why people should reach out to Matrix Services, the things that you have. Yeah.
Sure. Anybody that wants to get in touch with us, it's just our website, matrixhumanservices.org. You will see a list of resources that we have available for people to take advantage of. We also are hopeful that people are still in the giving season with understanding with all of the work that we do, this stuff is not free, and we need extra people who have the capacity to give, to continue to give, so we're able to provide all of these resources to clients for absolutely free. None of our clients pay a dime for anything that we do. And if people want to get involved, they also can volunteer with us as well. As we start to reopen, those volunteer initiatives are going to come back in. So all of that is a one-stop shop on our website, matrixhumanservices.org.
Brad, you got anything you want people to know?
No, I think Kerrie just summarized it nicely. So I just appreciate you having us on today. We really enjoyed it.
No, it's been my pleasure. And
Yeah.
so, Kerrie, thanks for joining. Brad, thanks for joining. This has been the We Can Do Better podcast with Senator Adam Hollier, and we got to have a really robust discussion about Matrix Human Services and all the wonderful things that they're doing in the 2nd Senate District across the city of Detroit that really impact the state of Michigan. So once again, we're really grateful to have you and looking forward to doing more good with you soon.
Thank you.